So first, I would tell MPN patients that I'm incredibly hopeful for the future as we treat these diseases. We've learned a lot. I think we have many more therapies now than we had certainly when I started my career, and I think we know how to use them better, whether it be interferons, JAK inhibitors, or even other aspects such as hydroxyurea and other medications. But the future is very bright, and I would put it in several categories. First, we're learning much more about the disease. So these diseases are interlinked, but key things that we've not known, but that are the focus of study, is why do they develop and why do they progress? So how can we better target that to either kind of control the disease permanently or ideally to cure the disease? Second, there are many both scientists as well as drug companies developing new therapies for MPNs. And that's important because therapies that are specific for MPN patients may be more effective, may be more safe than us using drugs that really were developed for other diseases that we then try to apply in MPNs. So that includes current trials for drugs in combination with ruxolitinib. There's a whole range of different new types of drugs that are being developed that are working to block aspects of the biology of MPNs to complement that JAK inhibition. So we've learned much more about how to best manage myelofibrosis. Even with the drugs we have, we've learned, one, certain things such as optimizing the dose of ruxolitinib is important. Having enough of a dose to really try to impact the disease. We've learned more about trying to improve some of the symptoms patients face with complementary approaches to their medicines, whether that be yoga, whether that be meditation, whether that be diet or other aspects of their health. So I think we've learned much more. Patients that have progressive disease towards acute leukemia, we now have new approved therapies for acute leukemia that might be beneficial, and we're learning more about that as well. But that has expanded the number of options we have if people have progressive disease. In the future, the treatment of both blood diseases and cancer are advancing very rapidly. And important new areas of focus are, one, optimizing the immune response against the disease. That's something that has been very impactful for different types of cancers, but has not been impactful yet for myelofibrosis. But I envision that that will change, revving up our own immune system to attack the bad cells. Second, there may be immune-based therapies or vaccine therapies against certain types of myelofibrosis, particularly those with calreticulin. Third, the initial studies in what are called gene editing, where they try to go in and correct the gene that is mutated or affected, are ongoing with technologies like CRISPR. Those have started in sickle cell anemia trials, but they may well become an option in the future. And finally, there are cellular-based therapy approaches with treatments called CAR-T, or engineered T cells, that have been impactful against lymphoma and myeloma, and we're hopeful will soon become helpful against diseases like MPNs and myelofibrosis. Well, patient education events are incredibly important for several reasons. First, they give people a sense of community. They're not alone as they face these diseases. Even today, as there's people both here in the audience as well as watching the live stream, there's a community of folks, both in the UK and probably internationally, that are benefiting from this information. Second, it helps to really alleviate or at least diminish anxiety. Lack of understanding can create a lot of anxiety. What is the disease I have? What are the options? Are people working on the disease? Do doctors want to try to cure it? So being able to learn more about those things in a setting that is understandable for a range of individuals, can be impactful. Actually, my group previously did a study on a similar sort of patient meeting where we had questionnaires. Patients were consented, they participated in the full day event, and then we had follow-up at 3 and 6 months. We found that it improved disease understanding, decreased anxiety, and had a lasting impact on anxiety and confusion.